Today we're going to start working on forearms. A lot of CrossFitters, because we do a lot of work holding onto barbells and holding onto a pull-up rig, we get a lot of tension in the back sides of our arms, and we can develop what's called lateral epicondylalgia or tennis elbow, which is an overuse injury of the common extensor origin. So in your forearm you have a group of muscles that come together and they join at one specific point, which comes into the thumb side of the elbow, and that's your common extensor origin. So it tends to pull, it gets a little bit swollen, and you can get some lateral elbow pain. So today we're going to do a couple of releases that are going to go through the forearms to try and loosen up some of the adhesions that are there, and then we're also going to do what's called a voodoo band, and what that's going to do is it's going to apply compression to the tendon that's swollen. It's going to cut off a little bit of blood flow, and when you unwrap it, it's going to cause a rush of blood flow that's going to help clear out some of the inflammatory markers that are inside the elbow. Okay, so Annie is going to be our wonderful demo today. So just grabbing a lacrosse ball, I have it up on boxes because it's a little bit easier in terms of positioning. You're going to come into the forearm, starting at the wrist, and then you're going to come through, pressing down with your opposite hand, coming up that muscle group. So all the tendons come in from the hand, come up through the wrist, and attach into the elbow. So you want to make sure that you're starting down a little bit lower. It's probably going to not be as intense as you get lower, but the pressure is going to feel a lot harder as you get up towards the elbow. Yeah. So if you find a spot that feels worse than others, you're going to keep pressing down. You're going to flex and extend your wrist, and that's going to cause a glide through the muscle, so you're attacking down and gliding through. Yep. And then you're going to keep going up towards where the tendon is, which is right here. You want to think thumb side, and it's going to be right on the outside of the elbow. Yep. Yeah. So this is probably going to be the most point tender spot, is right where it attaches, and that's okay. So just moderate your pressure accordingly. So step 2, we're going to use the voodoo band. So what you want to think with this is that if you have any pins or needles or anything coming into the hands, that's when you want to unwrap it. You want to think that there's going to be about an inch overlap, and you're going to start above the joint and go to below the joint. So you're going to come through. You're not going to tighten the entire way, you're just going to tighten along the back. Any pins and needles? Nope. Any smaller, so we might not even get through the entire thing. Gotta get more jacked. Okay. So we're gonna come through, I'm just gonna tuck it in. And then you're gonna flex and extend your elbow. Coming through. Any pins and needles? Nope. Be careful that you make it nice and snug, and then sometimes it's a little bit difficult to get the band underneath, but just make sure that you're getting that tight seal on it. Yeah. So fast forward 2 minutes, we're gonna take it off. And this would just help with a little bit of pain management if you do have pain on the outside of your elbow. Okay? Sometimes you'll see kind of marks coming across your arm. That's totally okay, it's normal. The only thing that I would be conscious of is if you're starting to get numbness or it feels like your hand is falling asleep, then make sure that you ease off. Okay, so for outside elbow pain from a lot of heavy gripping, it's an overuse injury, so make sure that you do ease off in terms of the amount of volume that you're doing on a barbell or hanging from a pull-up bar, and then lacrosse ball and the voodoo band.